We're just two moms. We're expert contributors to FamilyAffaires.com. I'm Christy.
And I'm Debbie.
And the focus this month for October is health crisis. And Debbie and I have actually been through some health crises with our son. I win the prize for being at the ER the most. But Debbie, I think you've had your son to the ER.
This is our number. And you are?
5.
Okay.
We're 5.
Yeah.
My daughter, 0. So...
Lucky her.
Yeah, so the health crisis with the special needs kids can be extremely challenging. Really, really challenging. I've been to the ER, like I said, I think 5 times, and 3 of those times I went in an ambulance, which is even more fun because there was something going on. My son had a history of seizures when he was younger, fever-induced seizures. So the first time that happens, that's kind of scary, and you call 911 and the ambulance comes. Later in life, he had another seizure that was unexplained, and he started turning blue. So then you call 911 again and have the ambulance come. So that can be really scary. And the ER for our kids, we're scared, they're scared. It can be really, really challenging.
And then you deal with a line of people, or you're sitting and waiting. I mean, it's everything.
Well, when you come in the ambulance, Debbie, you don't really have to wait for people.
It's like the fast pass at Disney.
It is the fast pass, yes.
Sorry.
Absolutely. Absolutely. But that health concern can be really challenging. And communication-wise, I mean, it can be very difficult to figure out where your child is hurt or what's going on. That was very tricky for us to try to figure out where, if there was any pain, where the pain was. Trying to, with a seizure, he has come out of it, and so we're trying to get him to talk and find out if he's oriented, but he's never, it's hard to tell with someone with autism sometimes if they are oriented, to ask the right questions. Right. So it's very, very challenging for us.
Yeah, and for us, you know, it's sublime when I think about what you went through, but for us it was a kindergarten injury where he clipped his pinky and his finger was sticking out to there, and colorful and very shiny. And the interesting thing about that visit was our first visit at the time. They put a cast on him from pinky up to the elbow.
and how tall was he? Like this tall?
He was in kindergarten, but super tall.
Okay.
But they didn't have anybody who could read the x-ray at night. It was a 10 o'clock thing.
Yeah.
And so they had to cast him because they couldn't read that until the following day, until we took him to the orthopedic doctor that they recommended. And we sent him to kindergarten the next day, and I got the call by about 9:45 saying, "Mrs. Schmidt, could you please come pick up Jordan? He's just miserable. He doesn't want to be here today. He keeps asking why he has this cast on." And he was right. He had every reason to be
You were wondering
upset.
why he had this cast on.
We all couldn't figure it out. But, you know, again, it ended up being a double tape because you can't really do very much with those things. And, you know, the questions, the constant questions of, you know, figuring it out. How much pain are they in? Do you treat that for pain? You know, all of these things. Where is the pain? Obviously, with different things.
Right.
And then if there is a wait in the hospital, what do you do? How do you treat your child with that? Because there are people that you're sitting with that don't understand why your child is a motor mouth and is constantly going up off the chair to try to walk around, to try, you know, it's very difficult. So we totally understand and sympathize that at some point our special needs community will need to use an emergency room or, unfortunately, the ambulance. And what you go through is all a different story, and we all have obviously stories to tell from that. And there's really no way you can prep your child,
right?
But you know that you're going to need services at some point, and you just hope for the best.